Since 1895, millions of people throughout the world have benefited from chiropractic care. In this presentation, let's explore some of the lesser known reasons and benefits that chiropractic can offer you. Your body under regular chiropractic care can experience increased energy, reduced stress, improved immunity, faster healing, and of course the all too familiar pain relief. Let's begin by exploring health versus sickness. Because most people, when they go to a chiropractor, or any type of doctor, they're usually going to be motivated when they don't feel well. So how do you know when you're sick? Well, if you look at the list at the bottom, you can see there's a variety of symptoms: pain, fever, swellings, chills, sneezing, vomiting, and this list can go on. But we're familiar with these. These are motivators to get us to a doctor, a hospital, a medicine cabinet, you name it. When we don't feel well, we want fast pain relief. So the reverse should be true. How do you measure health? Is health measured when we take medications, potions, and lotions, wipe out these symptoms? Is that the true measure of health? Well, we have to ask ourselves, if that is the case, then why does the body produce symptoms? What is the purpose of symptoms? Is it just to make us miserable, to make us feel bad? Or does the body produce pain and symptoms for some underlying cause or reason other than just to make us feel miserable? Well, it certainly does get our attention, doesn't it? Well, if you look at this chart here, let's delve into symptoms a little deeper. Symptoms, it's like a body's alarm clock. It lets us know that when it's time for something. Now, we can certainly agree that it does get our attention. But symptoms, they're more than just attention grabbers. Because if you look at this chart here, it says that symptoms, whether it be shoulder pain, headaches, neck pain, back pain, you name it, it tells the brain that the body cells are in danger of death. Now, that's a pretty strong statement, and I have to explain or qualify that statement. Healthy, active, vibrant, alive, well-balanced, and well-functioning cells, tissues, organs do not produce symptoms. So when we have symptoms, we know that there has to be some underlying problem or imbalance in the body. So when we reach for pills, potions, or lotions, drugs basically mask the symptoms and in essence providing us an increased level of comfort while we're dying on the inside, even if it's just on a cellular level. When you take medication, the medication approach really does not address why we have that pain or symptom in the first place. It just masks it. Let's use a classic example of pain or symptom. Let's say you're a runner and you fall and you bang your knee. This would be considered a sports injury. You know there's going to be certain symptoms associated with that injury. Let's take a look. Now, we medical professionals or chiropractic professionals call symptoms of inflammation the changes that take place inside your body when you have that type of an injury. And you can look on this list: pain, edema, redness, fever. These are classic changes that the body produces actually in response to that injury. Now, these changes the body produces themselves in response to an external damage. So how do we fix this problem? How do you know what to do here? So how do you relieve it? Well, the first thing we have to consider is pain. To get rid of the pain, typically we're going to reach for a painkiller. And that's going to certainly give us a lot of immediate relief. What would be the next thing? Well, how about the edema? Edema is a medical term for swelling. If you take some type of an anti-inflammatory, that will certainly bring down the swelling or localized increase in fluid around that injured joint. And lastly, fever. Well, that's a localized increase in temperature. You touch that injured knee, it's going to be hot to the touch compared to the good one. What do they tell you? What do they recommend? Ice. Put ice on it for 20 to 30 minutes. That's going to reduce the fever or localized increase in temperature. So now the question I ask you is, doing all of these approaches, did you make the inflammation get bigger or did it make it go away? Well, the obvious answer is, of course. The inflammation goes down, it goes away when you take painkillers, anti-inflammatories, ice. It's going to make you feel better too, isn't it? But why does the body produce these symptoms? Well, obviously, we already said it was a trauma, it was a damage, it was some type of an injury. Inflammation, I'm here to tell you now, inflammation is your body's response to an injury, and the symptoms associated with inflammation is your body's best way at healing and repairing that damage. Because tissue damage results from trauma. So your body has to repair that damage in order to consider you healed. Not just getting rid of the symptoms, but actually repairing the damaged cells and organs, the tissue. Let's look at an example. For example, here of inflammation right out of a medical dictionary. If you look at an inflammation, it's described as a reaction to an injury such that the body repair process will start to heal and replace injured tissue. Now, I don't know about you, but we've been taught to take anti-inflammatories since we were little children, and if it says here that it heals and replaces damaged or injured tissue, why are we so quick to reach for anti-inflammatories or any kind of medication that's going to reduce the body's ability to heal? Now, I have a word for that. It's called chemical interference to your body's healing ability. Why? Because if you look at the package insert here, this is right out of an anti-inflammatory box from a drugstore. It says corticosteroids, such as this is prednisone. Corticosteroids inhibits the inflammatory response. Well, it should. It's an anti-inflammatory. But it goes on to say that it will probably delay or slow healing. Now, they're being a little polite here. They're being kind of sweet about it. The reality is, this medication will interfere with your body's healing process or ability to repair that damage. And again, I like to refer to this as chemical interference to your body's ability to fix the damage or heal. Chemical interference is not what we want to do long term to stay healthy. Short term, yes, you're going to feel better. But long term, we're doing more harm than are good. And if you look at some of these studies, anti-inflammatories appear to impair healing after rotator cuff repair. FDA advisor warning, COX-2 inhibitors, which is an over-the-counter anti-inflammatory, increase the risks of heart attacks and strokes. Acetaminophen, that's another over-the-counter, may be a leading cause of acute liver failure. So we could see from here, not only does the chemical interference slow down or stop your body's repair process, there may be some downsides to using these. They're not just neutral. So what does medicine do? Well, it masks symptoms. It's supposed to do that. That's why we take it, isn't it? It creates a chemical interference, and in essence, it creates chronic illness. We're getting the opposite effect, and I should explain that. Your body has a window where it needs to repair damage. If it's a broken bone, you know it takes 2 to 4, maybe 6 weeks. You put a cast on it, and it's better. It heals from the inside. That's a specific window of time that we're all familiar with. You're not going to wear that cast for a day or two, and you're not going to wear it for a year. It's 4 to 6 weeks in general. But what about a soft tissue injury? When you have a sprain or a strain, or you injure a joint, a ligament, a tendon, that window of time is pretty specific, but it is bigger. Rather than being a couple of weeks, it may be 2 to 4 months, depending upon how serious that injury is. But if you rely upon the medications and pills and drugs, in essence what you're doing is you're slowing down or stopping your body's repair process such that no matter how specific that window of time is, you're not fully reconnecting those damaged fibers. You're not fully healing that injured tissue. And that's why we're familiar with people who have, let's say, an injured knee 10, 20, 30 years ago. And, you know, they're better. They can walk on it. They're fine. But if they have to climb stairs or run to catch a bus or put any kind of strain on it, or let's say even if the weather changes, they're going to start to feel it throbbing or aching. It's going to act up. That's, you know, their bum knee. That's their chronic problem. This is an example of what we're setting ourselves up for. So when you go to the drugstore, there's a lot of choices there to relieve your symptoms. But keep in mind, while short term this may give you some relief, it's not really adding any health to your body or any enhanced ability to heal when there's damage. We do not want to rely on medication for every little ache and pain. So now, the question regarding, let's say, aspirin, if you take that into account, how does aspirin find the headache? Is aspirin that smart a pill that it knows to go right to the source of the problem and leave the rest of the body behind? Leave it alone? The truth is, when you take any kind of medication, your body has a lot of cells, trillions of cells. And the aspirin doesn't just go to the bad part. Aspirin and any medication, whether it be antibiotic, anything, touches every cell in your body, even the good cells. Unfortunately, the headache may go away, but when that medication, such as an aspirin, affects the healthy cells, they make those cells sick. And that is why we have side effects. Side effects come from the vast majority of your cells being affected when they shouldn't have been. Let's go over some interesting statistics here. The numbers are shocking. They will shock you. A statement from president of Eli Lilly and Company some years ago, a drug without side effects is not really a drug. So what kills more Americans every year than two wars, World War II and Vietnam combined? Well, 106,000 pharmaceutical drug side effects every year cause Americans to die. So we know that side effects can be deadly. What is the third leading cause of death in the USA? Right out of the Journal of the American Medical Association in 2000. 250,000 people every year, 685 people every day die from properly prescribed medication. So medicine, as we're taught, is the answer to our health problems, has a downside. There are risks, and we have to be aware of that. So the American healthcare system, as a whole, is the most expensive healthcare system in the world, to the tune of over $2 trillion now. This only goes to 2004. In the last 6 years, it just kept on increasing. So if we have a $2 trillion healthcare system in this country, do we have the best healthcare system in the world? Well, the question is, we spend the most money. What are we getting for our dollars? Let's take a look. If you look at the World Health Organization ranking of the top 40 healthcare systems in the leading industrialized nations, look at the US. We're 37th out of 40. We have the most expensive but almost the worst quality healthcare in the world. So then the question begs an answer. What is health? How do you know when you're healthy? Is it only when we have no pain or swelling, no fever, no symptoms? We really have to dig deep and find an answer to our question. How do you know when you're healthy? How do you really know? Well, if you look at an example of a heart attack, more than half of heart attack victims die. The first symptom is death. They didn't have any pain the day before, even an hour before. Their first symptom is death. So your body does not produce symptoms most of the time to let you know when there's a problem. Symptoms are a very poor indicator of your health status. And it's not a good idea to rely on pain or symptoms to let you know whether you're healthy or not. Now the question, do you see health in any of these examples here? If you look at these, when you go to a doctor, you're going to see a lot of these objects on the screen here. Do any of these add any amount of health to your body? I like to describe these healthcare tools as assisting your body's healing process, but they don't really add health to your body. They assist what you are given. Your God-given ability to heal comes from within. And these are simply tools or mechanisms of assisting the healing process that is already inside you. So, what is prevention then? If you look at the definition of prevention right out of Webster's dictionary, to keep from occurring, to avert or hinder. When you prevent something, it never happens in the first place, not even a little. So if you look at these tests or these very common medical screenings, every single one of these is aimed at earlier and earlier detection, but none of these can really prevent the very disease that we're trying to detect. But unfortunately, the medical profession will use a lot of these tests and label them as preventive medicine. Unfortunately, there really is no true prevention in our healthcare system today. About the only true preventive tool is brushing our teeth. And that's a very small aspect of our health, or I should say a small part of our body. We need to practice prevention in every aspect of our being. And this is a great example. This is an advertisement right out of a medical clinic in a local paper. It says here, our patients will receive highly personalized preventive health care year-round. The difference in the delivery of preventive health care is dramatic. Patients pay an annual membership fee, $1,500. The program includes an extensive health risk factor assessment and a comprehensive physical with lab testing EKG screenings related to mental status, exercise, nutrition and sleep, vision, hearing, and pulmonary function testing. The exam is focused on early detection to address health concerns before they become serious. See, once again, the medical profession tries to use preventive terminology, but in reality, all we are receiving, with the best of intentions, is we're receiving early detection. My definition of prevention is when you can avoid the problem in the first place, when you absolutely, positively don't produce that within your body under any circumstances. Early detection is not prevention. So if you want to get to health, where do you go? Up until now, you've gone to the medicine cabinet, you've gone to the doctor, the hospital, the clinic. Where do you really have to go to get true health? It's not going to be here. From this point forward, we're going to go within your body where you were given the ability to heal anything. We want to tap into your body's innate or natural, inborn ability to heal anything from a broken bone to a cut to the flu to cancer and AIDS. It's been done and it will continue to be done. Let's show you how. First of all, if you want to get healthy, it would be a good idea to know what health is. Up until now, we felt health has been described as being pain-free. But look at the dictionary, right out of Webster's dictionary. It's a condition of wholeness where all of your tissues and organs are doing what? Functioning 100% all the time. You'll never see a definition of health in any book or any dictionary anywhere in the world where they relate health in any way to whether you have symptoms or no symptoms. It's always about function. So we're going to explore this. Let's return back to the process of inflammation and add what we now know to this concept. If you look on this chart, it shows you some white blood cells, some red blood cells, platelets. These are some of the blood cellular elements to inflammation. Now, if you look on the left side of the screen here, you can see that there's a nerve fiber connected to this blood vessel. What part of your body controls the inflammatory process and thus controls healing? Well, it's the nervous system. The nervous system controls all healing in your body. And if you look, right there is the master controller of your body. If we were to take that nerve out of the picture, just totally remove it, what would happen to your body's ability to heal? It would probably slow down or stop, wouldn't it? Well, by taking medication, in essence, what you're doing is you're taking that nerve out of the picture, because pain medication, and a lot of different medication, slows down or interferes with that nerve signal so that your body doesn't register the pain. Unfortunately, medications are not selective. They do not selectively stop pain signals, but let the other function signals through. So your body has a problem there. That's called nerve interference. Remember, we called that earlier, chemical interference. What we want to do to allow the body to heal naturally is to remove the chemical interference and allow your body to do its job without any interference or problem. So what heals is the difference between life and death. In essence, what heals is life. The life force in your body flows from your brain to your body, and it coordinates and controls every bodily function, including healing. We take healing for granted because we know, we expect it to happen. When you cut your finger or break a bone, you know it's going to heal. But it's the life force that does that. And we need to tap into that. The power that made the body heals your body. It happens no other way. It comes from within. So healing coming from within, let's call it the doctor within. We have to think outside the box, because up till now, by relying upon medication, by relying upon a cast, by relying upon drugs and surgery, we really have been oriented towards outside-in healing. In other words, putting something inside the body from the outside and thinking that that's what's healing us. We're going to think outside the box now. Each patient carries his own doctor inside him. We are at our best when we give this doctor who resides within us a chance to work. Albert Schweitzer, MD. Your body, the world's greatest drugstore. This is some radical thinking here, but this is the way it works. So your body, chemistry is God's greatest drugstore. If you look at this list of different hormones and different body chemicals, every one of these has a purpose in keeping you alive and healthy and healing you. This is just a partial list. There are millions of different chemicals inside your body, but every single one of these is produced in the right concentration, at the right time, in the right place, and there's never a side effect. And it's all free. This is your body's innate ability to heal itself. So the power that made you heals you from within. What we're going to show you is how chiropractic care can tap into that innate healing ability to give you maximum health from day one. So your body knows how to heal. It just doesn't want to have, and we don't need interference, not with chemicals, not anything. Let's learn to allow the body to do its job the way we've never been shown before. See, we all begin 100% perfect. I want to take you back to the beginning. We've all begun here. In the absence of any kind of birth defect, mental or physical, we come into this world pretty much on an equal footing, on solid ground. Now what happens? How do we get to this point as a newborn where we have the ability, I mean, believe me, a newborn baby hasn't gone to college, hasn't read any books, so how does the newborn baby know how to heal a cut or a broken bone? Well, if you look here, on the left side, we show a sperm and an egg. They come together. Well, something has to happen after conception to get to the bottom here where you have a perfectly healthy newborn baby. Well, two things have to happen. One is time. We all know it's about 9 months. But the second thing that happens over this time period is your body rapidly generates and develops new cells. That tiny little fetus and embryo is creating life. It's creating cells on a massive scale. So that over the course of time, the very first recognizable organ or system that comes into being is what? Well, the picture here shows a primitive brain and primitive spinal cord. Your nervous system comes first. And if your nervous system is not produced in a healthy way, we have birth defects. An example of this is if a mother is pregnant, if a woman is pregnant, what What is the one thing they tell her to avoid? They say during the next 9 months, do not take any medication, and don't smoke, and don't drink alcohol. These are the no-nos. What do these all have in common? Well, they're all chemicals. Remember we talked earlier about chemical interference in the body. Chemical interference as an adult or a child in your very body can interfere with your nervous system's ability to perform functions. This is why we take pain medication, because you don't feel that pain signal. But in the embryo, these chemicals can actually interfere with the nerves during the very creation of nerves and the organs that they produce. See, if you look at your body, how many cells does your body have? Well, we said there were trillions. There are 100 trillion cells in your body. Every cell, every one of those 100 trillions has something in common. They all have a nerve connected to it. There's nerve supply. So the question is, if you have 100 trillion cells, how many nerves do you have in your body? Well, it's a one-to-one relationship. You have 100 trillion nerves in your body. So you have a lot of nerves. 100 trillion cells, 100 trillion nerves. If you were to remove the skin and bone and muscle and organs and just leave the nerves in there, it still would have an image or an outline, a silhouette of you. You could still recognize you, sort of. Your nervous system reaches out and touches every part of you. All your cells, tissues, and organs, all 50 to 100 trillion of those, have one thing in common. They have a nerve supply. So if there's interference to your body's ability to heal in the nervous system, we call that a mechanical interference. The most common kind that chiropractors deal with every day is mechanical pinched nerves. And that will actually block the signal from the brain cell to the tissue cell, where it's supposed to tell that cell how to heal or how to reproduce or how to function. I don't necessarily care for the term pinched nerve, because when I tell you or ask the average person what is a pinched nerve, immediately somebody relates that to a pain or a symptom. But the truth is, 99% of the time we don't know when we have pinched nerves. They don't scream out in pain. The term subluxation is much more definitive. It describes it much more adequately. Because a subluxation is when you have a mechanical interference in your spine. It's creating a blockage to some of those signals in that nerve where you see the red arrow. But those signals are still getting through. We're just not getting 100% of those signals through. Now you could see the nerve above and below. They look okay. But that nerve, by the red arrow, that nerve is dying. There's an interference there. And if you trace that nerve, it's got to be connected to something. And in fact, it's connected to some cell, tissue, or organ that is not receiving the life force that it's supposed to receive. That's what we call a subluxation. It may not be a muscle. It could be an organ. A subluxation, when it does connect to a muscle, when that nerve is connected to a muscle, you're going to feel that in terms of spasm, stiff, sore, achy, tight, dull, sharp, painful muscles. That's what we're familiar with. And that's what gets us to a doctor, to a medicine cabinet. We're all too familiar with that. But the vast majority of the nerves in your spine and in your body do not connect to muscles. They connect to other vital organs. So if you look at this chart here, here's a perfect balance between the brain and the body. You can see the spine is kind of the relay station between the brain cell and the tissue cell, the organs. And if you see here, the brain, and I have 100% up at the brain, what that tells you is that the brain has 100% intelligence. That is the same intelligence that created the body from that embryo. Remember, the nervous system is what created you in the embryo over the course of 9 months. It comes first, and the organs follow. So that brain, your brain is constantly sending signals up and down the spine. Every organ in your body requires 100% of that signal to get through in order for you to be healthy. Now let's take a look at some examples here. If we take a scalpel, I'm going to play surgeon here, and we cut that nerve to the heart or the lung, how much of that signal gets to the heart? Well, it shows it there, 0. Now we can call that paralysis. If you cut a nerve in your body, that paralyzes whatever body part or organ that nerve goes to. That's not necessarily a chiropractic situation there. That's a medical emergency. You'll end up in the hospital, in the emergency room. But let's put our scalpel away because we don't want to kill the patient. What if we just pinch that nerve? What if we put pressure or stress or pressure, some type of interference on that nerve? Remember the term subluxation? Now we have the brain sending 100% of that nerve signal, but only 70% is getting through. You can use any round number, maybe 80 or 92 or 68% is getting through. Anything less than 100% of that signal getting to the end organ is less than perfect health. It's suboptimal health or dysfunction or dis-ease or a lowered state of health. That's not the optimal state that we want to be every day of our life. The only way to correct this problem is to remove the pinch or interference, and that's what an adjustment, chiropractic adjustment, does in your body. Now, as you can see, the arrows also show this is a two-way street. If your heart was at 70%, you can live your life with your heart functioning at 70%. You may never even know it. Unless you were running to catch a bus or climbing stairs, you may have heaviness, shortness of breath, you may have chest pain, a lot of things that may happen when you put stress on the heart. But as you can see, this communication channel is two-way. The heart also sends messages back up to the brain. But if you're climbing stairs or playing sports and your heart needs more energy to keep up with you, what is the heart going to do? It's going to message the brain, hey, I need some more juice down here. Send me some more. There's a lack here. Unfortunately, that blockage is two-way. And the brain, as far as it knows, it's doing its job. It sends 100%. It always does. It never ceases to do its job. It's not aware that there's a problem somewhere down the line. So another concept to bring in here is repair and regeneration. This is something else that your nervous system is constantly doing with your body. We already know about the repair process. If you have any damage, you have to repair it, you have to fix it. But what is this concept of regeneration? Well, all the cells, tissues, and organs in your body have a lifespan. Some cells last a day or two, some last a few weeks, and some could last for months. But ultimately, every cell and every organ in your body is going to get old and it's going to die. But the key is, before the cells die, they replace themselves. If you have a cell that's only functioning at 60, 70, 80, even 90%, it does still have the ability to regenerate a brand new cell. But is that cell going to be healthy, or is it going to be still functioning at or less than optimal? The truth is, that's how we build sickness and disease, on a cellular level, one cell at a time. When your nervous system is functioning less than 100%, you are regenerating and building disease silently. And it works something like this. If you look at these buckets, when you have interference between the brain and the body, you have a gradual accumulation of sick and diseased cells. The top bucket only shows a little bit of accumulation. The middle bucket shows you're halfway there, sick and diseased cells. At which point do you think most people are going to run and get help? Well, the most popular answer is when the bucket's overflowing. That's when you first know. Typically, the body's not going to start yelling or screaming in some type of pain or symptom until there's such a great accumulation of sick and diseased cells. But usually it's too late by then. How about if you can know when there's almost nothing? The pain starts here, but that's not the best place to get to the cause of the problem and correct it, is it? We want to get to the beginning. So the restoration of health back towards 100% utilizing chiropractic is our goal in the office here. Each adjustment brings you closer and closer to 100% function of your brain and body, and in essence a reconnection of brain and body, letting those channels of communication open up wider and wider. Now the brain sits on top. It sends messages down every second you're alive to your tissue cells. Subluxation is some type of an interference between the brain message and the tissue cell. So we can agree that your body cells, when they are at anything less than 100%, it's a dis-ease or a lowered state of health. As you can see at the bottom, the last thing to come is the crisis, the symptom. But typically, once we get to that point, what are we most what is the most common approach? Well, it's going to be to cover this pain, cover the symptom, just medicate it. But you could see from here, the symptom, it's just the tip of the iceberg. Most people in our culture don't even know what a subluxation is. If I ask 100 people randomly, what is a cavity? Even if they can't tell you exactly what it is, at least they can point to the right body part. They'll know it has something to do with the teeth. But if I ask people what is a subluxation, if I get 4 or 5 people out of 100 that have even heard of it, I would consider that a good odds. Most people haven't even heard of it. I would be surprised if more than 5 people. But yet subluxation can actually kill people slowly over time. That's how serious this is. Unfortunately, the pain relief approach doesn't do anything to correct the underlying cause, underlying problem. So now, how do you get subluxation? In a word, stress. If you see yourself on any one of these pictures here, and I know I do on almost all of these, you can bet that your spine is out of balance, your vertebrae are out of alignment to some degree somewhere, and there's going to be some interference in your nervous system. Stress destroys nerves. This is a study that showed the effect of stress on nerve fibers in the brain of a rat. And on the right, you could see the nerve fibers have been damaged compared to the left. Stress actually does physically and physiologically make changes in your body that are sometimes irreversible. So now, let's take a journey through chiropractic, starting with when you first come into the office and find out some of the changes that take place, some of the beneficial changes. The vast majority of people, when they come to see a chiropractor, when you come into my office, you're going to be on the left side of the chart. We're going to find you in column number 1, which shows you have subluxation. You can see there's a vertebrae that's out of place there. That nerve to the left of it is a damaged nerve. And whatever organ or cell is connected to that is not going to be receiving the energy or life force or information that the brain is attempting to get down there. The goal is to go where? Well, hopefully to the right side. You want to go to number 6. The number 6 column is where you have a perfectly balanced spine, no interference. Well, the first question I would like to propose to you, how long does it take to get from the left side to the right? Well, it's kind of a loaded question, because if you think about it, well, it may take a couple of weeks. Well, what if it takes up to a couple of few years? It's kind of a loaded question because there's so many variabilities or so many things that can affect your healing process. In essence, it really is different for everybody. But somewhere along the way, your pain is going to diminish and go away. At what point do you think that your pain is going to go away? Where do you think you will be rendered pain-free? Will it be number 2 or 3 or 4? What about 5 or 6? If I said to you, it's going to take a year to get to number 6, and I'm just using a nice round number. I love round numbers. We could just easily say 6 months. What if it takes a year for you to get from where you are now at number 1 on the left all the way to the number 6 on the right? Is your pain going to take a whole year to go away? The fact is that chiropractic is so effective at pain relief that most people, their pain is going to be gone usually in the 2nd or 3rd column. And to be honest, I don't even have to touch your spine. If I gave you a couple of really strong painkillers, you would be rendered pain-free anyway, and we didn't even do anything to your spine. So the reason why I'm proposing this question to you is, if your pain is going to be gone at, let's say, in the middle, number 3, does that mean that you're done? End of story? See you later, doc. You did great. I'll be back when I'm hurting? Or how far do you want to take this balancing of your spine, this getting adjusted? How far do you want to go with this? Because ultimately, in the end, making this change takes you towards a balanced body. And I should add to this the fact that when we put the vertebrae in proper alignment, going from 1 to 2, in fact, it's not going to stay there. It goes back out of alignment. Most people think that when they go to a chiropractor and get adjusted and their pain is gone, they don't have to come back. They're good to go. They're done. End of story. They're all better. But the surrounding tissue, the ligaments, the muscles, the tendons, the soft tissue that surround that subluxation, well, they've been like that for weeks, months, if not years. And those tight muscles are going to pull that bone right back out of alignment again. So in essence, we have to go from 1 to 2 and keep it holding there. This is why you've probably heard the story that people go to a chiropractor and the chiropractor says, you got to keep coming back, Mrs. Jones. I need to see you 3 times this week. Next week, maybe 2. We'll see how it goes. But you're going to need to keep coming in. This is the true reason why chiropractic benefits you when you keep going, because your spine doesn't stay in proper alignment by itself, because all the stressful things that you did to get in trouble, they don't go away. You still lift wrong. You still bend. You still sleep on an old mattress. We still sit on an office chair for hours and hours. There's a lot of things that we do to our body that we take for granted, that it is causing stress in the body. Because in the end, what we want to have is a properly functioning nervous system so our body can be functioning and healing better. Now, the road to health can be described as follows. Maximum health potential. You are at recovery when you're at your best, when you have maximum health. Now let's look at this road here. You make progress in the beginning, you feel better, you reach a plateau where you're out of pain, but that's probably the most cautious or troublesome area when your pain is gone, because that's the point at which most people are going to be tempted to say, I'm all better. I'm kind of busy, I have to go to my job, I have to pick up the kids, I have to go to the grocery store. I'm going to start skipping my chiropractic appointments because I don't really need it anymore because I feel great. The fact is, this merry-go-round or this vicious cycle, when you drop out of care, I like to call the aspirin approach, because you're going to backslide, no pun intended there, but you're going to go downhill again to the point where you were when you came in. And in fact, if you only had 2 or 3 or 4 or 5 adjustments and you feel great and you stop and a month later your pain comes back, you really can't say that the chiropractic didn't work. In fact, it did work. It just wore off. We didn't really give it a chance to get to a point of stability. And that can only be achieved at the top of this page here, where you could see everybody is at maximum health. So the changes that you could expect when you're under regular chiropractic care, yes, you're going to get relief from your pain, but you also have increased energy, you have better posture, you can stand up more easily, you're not slouched over. Your immune system is going to function better. You will have better sleep. You'll have improved athletic performance. If you're working out at the gym, you'll have a better workout. Your job, you'll function better on your job, you'll get along better with your spouse and your family, and we're going to slow down or reduce or even stop spinal degeneration, because degeneration in your spine, your discs, your bones, your nerves, comes from subluxation, a bone out of alignment. Now, lifetime family maintenance care. What is this concept and why would I put this in front of you? For a very simple reason. No adjustment given by any doctor can fix you instantly. And if it could, that adjustment would not hold forever. You would still need another adjustment. This is not a hard concept to really follow here. As we said a few slides ago, when you get adjusted, that vertebrae goes from one place to another intentionally by the doctor's hands. It will slowly go back out of alignment if you don't keep putting it back in alignment, because the muscles and ligaments and tendons around that subluxation need to be adapted to its new position. They will pull it back out of alignment. Do you remember stress? That certainly doesn't go away. When you leave the office and you drive in traffic, that's stressful enough. That could put stress on your muscles and pull your bones back out of alignment. If you see all the things on this chart, this is a very important concept. We have been raised to understand maintenance for your car, drinking healthy water, clean water, getting good sleep, exercising, eating a healthy diet. There are a lot of things that we take for granted that we know are good for us, and we have to learn to do them regularly. Why have we, up until this point, ignored our spine and ignored the possibility of regular maintenance care for our spine and our nervous system, the most elaborate and the most vital system in our body that keeps everything else in check and functioning properly? We've ignored it up till now, or at least until it hurts. So why look at posture? Because when I look at posture, I don't just see whether your hair is the latest fashion. I don't look at your clothes to see how nice and neat they are. I look to see if you have a spine that's out of balance. I look beyond the superficial and the obvious, because that to me is an indicator. If your spine or posture is out of balance, you know you have stress on your nervous system. It tells a lot about you, because posture is the window to your spine. All it takes is one subluxation, and your body is not be 100% optimal or healthy. When we look at posture, we don't only look from the back or front, we also look from the side. Your spine should actually have curves when you look from the side that can be diminished or reduced from the stress of injuries and trauma and accidents and even sleeping on an old mattress. This would be considered the big picture. When you look at posture, we're really not looking at the alignment of one vertebra, we're looking at the effect of a lifetime of stress. And believe me, when you or your children have spinal problems from an early age, even from birth, do you think as that child grows, those spinal problems are going to get better, or are they going to get worse? As their spine grows and matures, those problems from very early years will actually get bigger as they get bigger. Spinal problems begin in childhood. So what is the time for you to fix your spine? How long are you going to wait? If you see yourself on this chart somewhere, why wait until you're in what's called phase 4, where when you see seniors, they're practically bent over to a horizontal position? It's a little late. It's never too late, but it's a little late to really do major correction there. I'd rather catch you as early as possible. So now chiropractic care for children, for infants, for newborns has the following benefits. If you look at the website for the International Pediatric Association, Chiropractic Pediatric, they have a research foundation and they list all these common, quote, medical conditions that chiropractic has been shown. In a lot of cases, they actually did double-blind studies to show that all of these conditions have been benefited from adjusting baby's spine. And keep in mind, while there are benefits, a baby adjustment is not the same as a grown-up adjustment. A baby adjustment is more of a pressure than a twist and a pop. So if you've had any concern about, I would never bring my child to a chiropractor because I don't want my chiropractor to do what he does to me, rest assured, a qualified chiropractor will not adjust your baby the same way he adjusts you. It's a specific adjustment for him and his growing little spine. But we can prevent, if not reverse, a lot of these conditions naturally without the dangers of side effects of drugs. Now, regular exercise, we already know it's good. In fact, it only works when you do it regularly. But does it keep your spine in line? Will it prevent the spinal problems that we are too familiar with? Quite the opposite. If you're going to the gym and you're not getting adjusted regularly, well, I'm feeling good. I know I'm working out hard. I don't need to get adjusted because I feel great in the gym. Think again. A subluxation, when you put the stress of working out, even though it's good stress because it builds muscle, a subluxation can do more harm than good to your body with that kind of stress. So get adjusted whether you go to the gym or not. In fact, a lot of professional athletes now use chiropractic for what we call a competitive edge. Emmitt Smith, Dallas Cowboys. I definitely try to get adjusted on a basis where I can use chiropractic at least twice a week. I would definitely say that it helps me to perform at a higher level. Now, what do athletes have in common? They have the desire to have increased performance on the field. They want to have the competitive edge. And what gives you a competitive edge if you're an athlete? Well, your muscles and your nerves. We're talking about increased strength, increased flexibility, what gives you resiliency, what gives you coordination, reflexes. All of this comes from properly functioning muscles and nerves. Evander Holyfield. I have to have an adjustment before I go into the ring. I do believe in chiropractic. I found that going to a chiropractor 3 times a week helps my performance. The majority of boxers go to chiropractors to get that extra edge. See, they're using chiropractic adjustments not just to correct the problems that occurred during contact sports, like aches and pains. They're getting a competitive edge here. So you can have it all. With regular chiropractic checkups and adjustment, you can have all of these benefits that you see on this list. Chiropractic is not a modality that is to help you feel better and to reduce your aches and pains. It really does a lot of benefits for the body. It does the body good. And we can see our healthcare system has really been in a mess, and it certainly has been in the news in the last couple of years. I believe in my heart that our healthcare crisis is mainly from the fact that we really don't have a healthcare system in this country. We have a disease care system. The medical profession are experts at diagnosing, labeling, and treating diseases, but they really don't focus too much on health and improving that. With chiropractors, you can get to the crux of your problem, correct the subluxation, and allow your body to express better health naturally. So a fix for healthcare? Chiropractic first, drugs second, and surgery last. Remember, the power that made your body heals your body.